Good morning and good afternoon to everybody. Thanks so much for joining us today. My name is Dan Hollander. I'm the Chief of Party of the Sustainable Wash Systems Learning Partnership, and I want to welcome you all to our third webinar. This one is entitled Designing for Sustainability, Bringing Citywide Inclusive Sanitation to Ethiopia. Today, we are also co-hosting this with the World Bank, and we will both be jointly talking about our activities in the small town of Debre Birhan in Ethiopia. Before we dive in, I wanted to quickly just highlight some housekeeping. For those of you who haven't joined webinars in the past with USAID, we have a couple things within the interface. We have a question section, so please do add all of your questions as you think of them. We'll have about 15 minutes at the end to do a Q&A with our panelists, and we'll do our best to get back to you if we can't address your questions during the webinar. We also have a section on handouts, and we have a number of materials there, both from the Sustainable Wash Systems Program as well as from the World Bank. Today, we're going to hear both from Lucia Henry, who is from the SWS program, as well as from Gulila Berhane Shetu from the World Bank. I'm going to just give a brief overview. This is, as I mentioned, our third SWS webinar, but I want to provide just a brief overview of the program for those of you who are just joining us. So as many of you may know, the Sustainable Wash Systems Learning Partnership is a 5-year cooperative agreement with USAID, and we're focused on systems-based solutions to improving the sustainability of water, sanitation, and hygiene services. And I also wanted to note that today we're going to hear primarily from Tetra Tech as well as from the World Bank, but all of our partners, we have eight partners on this initiative, and they're all listed below on this title slide. Great, so next slide, please. So I think it's fitting, just before we dive into the content, to kind of set the context here, and I like to start with this slide here. We have obviously a failed latrine and a broken water pipeline, and this is really our core focus under SWS. We're looking at the challenges to sustaining infrastructure, and as many of us know in the sector, there's been a great deal of investment in infrastructure solutions, but despite that, we're really seeing unacceptably high rates of failures and a lack of sustaining of those services that infrastructure provides. Given that, our real focus is trying to look at the underlying factors, components, people that are involved in sustaining and providing those services, seeing how they interact, and then seeing how we can strengthen how they're functioning as a system in order to improve sustainability. So that's really our, the primary goal of the SWS program. Next slide, please. And it's obviously no coincidence that it's not just our goal, but we're directly supporting the agency's top line goals within their 2017 water strategy. We'll see here that it's not just about availability, but also about sustainable management of those services. And that's what we're really focused on. So under SWS, we're taking the approach to look at strengthening those local systems, those factors and actors that interact to provide those services. And we're looking both at some new innovative models as well as looking at different techniques that may be improved or strengthened to improve sustainability. Within our program, we're really focused not just on the services, but also developing an understanding of those systems and figuring out how we can strengthen them. Next slide, please. I won't go into too much detail here, but I just did want to highlight for those of you who are new that we have a pretty wide range of activities in varying scales, geographic scales. We're working primarily right now in East Africa, and Ethiopia, Uganda, and Kenya. We also had a pretty large collective action program looking at the national sanitation and hygiene sector in Cambodia that recently was completed. And also, today we're going to hear a little bit more about, from the SWS side, our collective action approaches. But we're also very focused on a variety of maintenance models, focused on guaranteed services, as well as preventative maintenance, and we're looking at those in the water sector. And I also just wanted to highlight that we're what's called a learning partnership, which means we have a great deal of resources dedicated not just to the implementation, but also to capturing what we're learning about systems, what we're learning about strengthening systems, so that we can feed that into the sector and hopefully inform future programs. Next slide, please. Within SWS, we have a couple of themes that kind of cut across our various activities. Today, we're going to be focusing on collective action as applied for small town sanitation in Ethiopia. But also, I wanted to just highlight that we're looking at various applications of maintenance models, as well as some tools and techniques to integrate network analysis, as well as ways to capture and to both to influence stakeholders' understanding of the systems within WASH programming. So if you're interested in any of these other themes as well, please stay tuned and reach out to us if you want to learn more. Next slide, please. In terms of collective action, today we're going to hear about some work at the small town scale in Ethiopia, but I also wanted to highlight that as part of SWS, we're looking kind of at a range of scales to see how some of these approaches differ when they look at different levels of what's, quote unquote local. We're working at the district scale in Ethiopia and Uganda. We're looking at the county scale in Kenya, as well as, we were looking at the national scale in Cambodia. And the idea is to really try to develop some broadly applicable guidelines and learning and lessons around collective action. Next slide. And as I mentioned, this is great. Yeah, as I mentioned today, we're going to really be focusing on the application of what's called learning alliances, which is a local stakeholder collective approach to improving service delivery and sustainability. Great, next slide. So now I wanted to turn it over to our two presenters. First, we'll hear from Debre Birhan from the World Bank. We'll hear about their approach to investing in developing sanitation infrastructure. We'll focus today on Debre Birhan, but this is really a countrywide program. The new program is called the Ethiopia Second Urban Water Supply and Sanitation Project. That will be followed by a presentation from Lucia Henry. She's from Tetra Tech, and Tetra Tech is leading our small town sanitation work under the Sustainable Wash Systems program. And we'll hear about their approach to applying this learning alliance approach to improving sanitation service delivery as well. So with that, I would like to turn it over to Mr. Debre Birhan to hear more about his work.
Thank you, Mr. Daniel, for the wonderful introduction of the learning the learning process we started on, and also for the personal introduction. Citywide inclusive sanitation, just to begin with, is a planning approach. I mean, that considers the human right aspect, the addressing, the issue of, thriving, urban economy, and also it is looking into, the whole value chain of, the sanitation, starting from containment to treatment and reuse, and also partnership. I mean, these four pillars are, the most important in addressing, citywide inclusive sanitation. In line with, the principles of, the human right, I think we all have recognized, even, globally, that has been recognized. All our intervention should have to be so inclusive to address women, children, disabled, poor, rich, and all others. So even, allocation of resources has to be equally looked, with other, development, including, the operation and the maintenance, and also, it is all about, development of, qualified staff, and so. So as recently we experienced, in Ethiopia, and also globally, especially, to the less developed, countries, urbanization is becoming, you know, a big challenge, and it's becoming like mushrooming. So to address, you know, that issue, and also to change, you know, concerns into, you know, opportunities. So sanitation will play, you know, an important role. So this needs, you know, integration with all, you know, the town development planning, and also it looks into, you know, the cleanup of, you know, cities, and also, you know, it was all about resource recovery and reuse, as I mentioned, you know, earlier. To do this one, we have to look into, you know, the whole sanitation value, starting, you know, from the very complex problem of, you know, delivering a fixed solution, which is not working, you know, for a while. Diversity of, you know, solutions and approach is very important. Otherwise, there is no one way throughout the different, you know, culture, throughout the different, you know, geographical, you know, setups and all others. I mean, you know, so to do this one, it is very important to partner, you know, with all those who are working, you know, in the urban, and this into, you know, the urban governance issue. This also looks into, you know, urban development institutions, health, education, environment, and all others. I mean, you know, working, you know, on this area, including development partners, because this requires, you know, a resource which in most cases, you know, most countries might not be able to avail, you know, that resource. So partnership in terms of the working system, in terms of resource, and the governance are very important. So would you please, you know, next slide. Next slide, please. With respect to, you know, the project, as it has been, you know, mentioned earlier by Mr. Daniel, we have two projects jointly, you know, in one town, that is Debre Birhan, and the World Bank have the second urban water supply and the sanitation project, which includes or which support Addis Ababa and 22 other towns, and this is going to run from 2017 to 2022. The project has three subcomponents, two major components, Addis Ababa and the secondary towns, and the three subcomponents: the urban sanitation infrastructure development, which the major resource is allocated for; operation efficiency for utilities, which is supporting, you know, the utilities to be more effective, you know, for service delivery; and institutional strengthening, including, you know, managing, you know, the project. On the other hand, USAID is running, you know, the sustainable wash system as learning, you know, partnership, which is focusing on small town sanitation component led by Tetra. In Ethiopia, they are doing, you know, on two towns. One is, you know, Waliso in Oromia, and the other is, you know, Debre Birhan in Amara, where we can have the same project. I mean, we have the project. So the purpose of, you know, this project, you know, is strengthening, you know, the local system responsible for sanitation service, specifically, you know, the fecal sludge management, which is part of, you know, the second urban water supply and sanitation project, subcomponent, you know, 3 and 2. And also, you know, the learning alliance approach is another intervention that the USAID Sustainable Wash System Learning Partnership is going to implement in the same town. So this has a good, you know, opportunity for the two institutions to align their intervention. Next slide, please. Yeah, this is, you know, a map that shows, you know, the boundary of, you know, the country, and also, you know, the towns where, you know, this project, the second urban water supply and the sanitation project is supporting. The towns are written, you know, in black for someone who wants to zoom. That is readable. I hope, and next slide, please. Next slide, please. Why we focus, on sanitation? I mean, we have to be very clear. I mean, why this is, very important, in this country. As I mentioned, earlier, urbanization is, an important factor, in developing countries, including, ours. In case of Ethiopia, currently, the urbanization is growing, more than 5% per annum, which needs an attention with respect to the service delivery, or which demands an organized, systematic service delivery system. The country has more than 900 towns with different scale and with different population size at different locations and different cultural and way of living, and also the challenge for each of the towns is completely somewhat different. So to address that one, there should be a mechanism, or there should be a systematic planning approach, both in urban sanitation and also for the other services. In fact, understanding our achievement during the MDG, the government has given priority for the sanitation in the national development agenda that's called the Growth and the Transformation Plan 2. As you have seen, on the right side of the PowerPoint, the Ethiopia has succeeded or achieved the MDG target for water. Unfortunately, the country is not able to achieve the target for sanitation. The growth for urban sanitation specifically was very low, about 1.2 against the 5% population growth. I mean urban population growth and urbanization. So if the country wants to meet SDG, the growth has to be tripled. At least acceleration has to go fast, as above 3% or even more. So that is why sanitation is becoming more focused and an interesting intervention for the bank and for other stakeholders too. Next slide, please. Just to share, the context of the country in a very nutshell. The population is now is growing fast, as I mentioned earlier, and it is more than 100 million. Though the population is growing so fast, still, the urban population, and also even the urban population is growing fast. Still, it is around 20 million or a bit slight above that. But this figure is expected to be double, by in less than 15 years. So it will going to be more than 42 million by 2032. This is a projection that has been made with urban studies. With respect to sanitation coverage, the basic nationally, according to the GMP definition and the GMP estimate, is about 18.5% for the basic, and there is still no safely managed sanitation facilities. So with respect to sewage, it is only less than 10%. Only we have in Addis Ababa, the capital city of the country, and there is a big intervention to increase this one as well. So if you look into the target set under the growth and the transformation plan I mentioned earlier, the target set for sanitation looks a bit ambitious with compared to the trend that came or that was seen so far. Next slide, please. Next. With respect to the institutional arrangement for the WASH, there are different ministries and the sectors that those are, playing, an important role. In fact, there is, an overlap of roles and the responsibilities. There is, also a gray area where, different institutions are not able, to reach. So that whatever the case, currently the Ministry of Water, Irrigation and Energy is responsible or leading on the wastewater management aspect, while other ministries like Ministry of Health is doing, the promotion aspect. Ministry of Urban Development and Housing is responsible for solid waste. Environmental Protection Commission is more responsible on the regulatory and, monitoring control, specifically on pollution of industrial pollution and the major, pollutions. With respect to, the local government, especially at town level, the municipality is responsible for overall, urban development, as well as the sanitation and the water. In fact, the municipality delegate, the role of, service delivery for water and the sanitation to utilities. Legally, utilities has become, like responsible, and especially as a result of the second urban water supply and the sanitation project, all utilities, or at least, the beneficiary utilities has been supported to have a dedicated, unit for the water, the sanitation aspect of, the town, the wastewater part. Water Resource Development Fund is also responsible to provide, loan for the utilities. Those are able to work, or those are investing, with the cost recovery principle. So it is very with a very minimal interest, but it's supporting, the utilities to get access to additional resource whenever, they want to have. Next slide, please. Next slide. This is to show you, where Debre Birhan is located. Debre Birhan is located towards, the eastern south part of, Amara region, adjacent to Oromia and also Afar. Next slide, please. Next slide. To give you, a snapshot of Debre Birhan, this is, an old city. You can see the picture down there. But taking into account, the age that was established in 1456, the size of the town is somewhat, moderate one. It is far from, about from Addis, about 120 kilometers. It is about an hour and a half drive, with an estimated population of, 100,000. Currently, it is benefiting, from the second urban water supply and the sewerage project, the USAID Suez project, and maybe also others who have to look, for that one. That has given opportunity to the water utility to be to improve, its service delivery, and it becomes, a very strong one, hopefully shortly. Next slide, please. Next slide. Just to give you, another context of, the sanitation coverage in Debre Birhan. According to, the Suez, data collected in April 2018, the sanitation coverage, in line with the definition of, GMP, or adopting, the definition of GMP, about 50% is basic. whereas about 37% is, limited, and still in the town there are about, 12.5% unimproved, latrines. Out of the available, latrine in the town, about 49% is shared among, maybe 2 or more households, while about 51% is, inside private sanitation. There is a facility of, mechanized, fecal sludge management service of dislodging that is done by the utility and also, by the private sector. As per the estimate of, the sewage, only about 40% of, the fecal sludge is emptying, or, that is a market for the domestic services. The slide in the right side, that is, the fecal sludge, the SF diagram shows you a bit, challenge around, the treatment, where out of, the 83% unsafely managed sludge, about 54% or something is contributed by the treatment, by the absence of, proper, treatment, whereas, the other might come from emptying service, from overflow, and the like. So the town is able only to safely manage about, 80% of, the fecal sludge. That is that shows, how the problem is, very severe, around, the treatment, and the need, for some infrastructure and the service delivery, a combination of service delivery and infrastructure intervention. Next slide, please. Next slide. Yeah, in applying, citywide inclusive sanitation, I think there are some steps which we have intended, to adopt before entering into, the program or the implementation of the project. We have to share, the concept and approach, the planning approach. This has been done, with Debre Birhan under the project, and as much as possible, people has to be aware, people has to buy in, the concept and the approach. In doing this one, we have organized, experience sharing in abroad, like Senegal. As an example, we took, some of, the people, to Senegal, how they are, to show them, how they are managing really, easily, with the fecal sludge management, where, and at the same time, while, operating, with other technologies. Also doing, like baseline assessment, feasibility study, and design. For that one, we need, engaging, consultant. The consultant engage the consultant. But now the term of reference has been developed. It has been agreed, and this will going to take place shortly. And also performance development guidelines, under development, which will help the towns to look into their operation system and to improve, their system. So in doing this one, also are documenting and also are learning, from successes as well. With respect to to take, very quickly, assessment and identification of current situation of the sanitation is a very important stage. Unless otherwise we understand, what the towns look like, it is very difficult to escape into the next stage, that is, the feasibility study and the recommendation of, the interventions. This will give us, the opportunity to look into the broader concept, the concept of, the citywide inclusive sanitation I mentioned earlier, like options in terms of technology, options in terms of institutional arrangement, financing, and the like. And also even, like issue of, affordability and, institutional capacity to run that one. This is an important stage. I mean, to go to know or to engage into the feasibility study, which will lead us, to the design of technically viable, and the sound options. In fact, once we are able, to design the infrastructure and also move into the implementation of the infrastructure, capacity building has to be accompanied. I mean, to sustain, the system the town is going to have. So we are supporting, in parallel, for all these, interventions, especially infrastructure development and the capacity building. Next slide, please. In applying, citywide inclusive sanitation, we have already an agreed, approach, and there is no one solution with citywide inclusive sanitation. It is a combination of, options that will take us, from the basic, to the very complicated one in an incremental way, through time. But taking into account, the situation in the country and in the towns, in the towns we have, stopping, open defecation is, one of, the priority that has been, committed, by the government as well as sustainable development goal. Then reducing, unsafe sanitation is the second step and is the second priority that we're going to address in Debre Birhan as well. Increasing, safely managed sanitation is third step or a goal that has been set, as a priority. If you look into, the diagram on the right side, it shows, how the improving, on-site facilities and also, even, other conventional systems will grow, and also, others are going to decline, like, open defecation has to decline shortly. If we have, manual impeting, that has to go also, because otherwise we're not going to have safely, managed sanitation system. So this model or the diagram here is, a guiding for the citywide inclusive, or the incremental changes that we are envisaged for Debre Birhan and other towns. Next slide, please. The other thing, as I mentioned, earlier, we have to deal, throughout, the sanitation value. We have to recognize all the values. Otherwise, if there is, some break, one stage, being it is, at the containment, impeding transport, treatment, or reuse, then the problem will come immediately, and we may not be able, to address all the needs. So for that one, even, to address issue of, containment at low-income, residents, we are proposing, and we are supporting, communal latrines, while, we are encouraging, others to improve into, the flush or poor flush, piped sewers, toilets. While in the same way, for the emptying, we are going to have the vacuum truck or some small, sewers or decentralized system with the conventional, sewer network. So with this combination and with this by recognizing, the value chain, we're going to address really, the problem, within the town and throughout the town. Next slide. Next slide, please. Okay, I now call Lucia to continue from this one onward. Thank you.
Thanks, Atagulalat. I'm Lucia Henry, and I will share a little bit about SWS's work in Debre Birhan, as well as our collaboration with the World Bank project, acknowledging that we are in the early stages of this collaboration. SWS applies a Learning Alliance approach in Ethiopia, and this diagram outlines the steps for setting up the Learning Alliance. I should note that this approach was developed by our SWS partner, IRC, who are also applying the approach in their rural water work under the project in Uganda and in Ethiopia. The Learning Alliance approach is a multi-stakeholder process in which people can address a common issue through working and learning together. It is through this process they strengthen their capacity as a collective. As with other collective action platforms, the group comes together under a common goal or shared vision. Given the importance of this, as well as trust and alignment, I'm sure you can imagine that it takes considerable time and effort to establish the Learning Alliance, and Tetra Tech plays the role of the backbone organization. Next, please. A unique aspect of the Learning Alliance approach is the use of action research. These are typically experiments designed by the Learning Alliance to address an issue. It is through the process of carrying out these experiments that the group can demonstrate the value of working together or working as a collective to its members. In the early stages of the Learning Alliance's establishment, the experiments are structured to allow the group some quick wins to reinforce this. Next, please. As Ato Gulalat mentioned, the World Bank project focuses on infrastructure investments in the 22 towns. And of equal importance are the accompanying activities to improve operational efficiency of the water and sanitation utility and support management capacity at national and subnational level. SWS is working with local actors to better understand and strengthen the local system for sanitation service delivery in the rapidly growing town of Debre Birhan. Our activities are based on the premises that this can be achieved by promoting local innovation through the action research, fostering learning, and developing their capacity as a collective. This will strengthen their working relationship within the Learning Alliance and the local stakeholders, and in turn will increase the sustainability of sanitation service delivery. The timing of the two projects provides an opportunity to achieve citywide inclusive sanitation. By working through the newly established Learning Alliance, there is an opportunity to make investment decisions that are informed by all stakeholder perspectives and to ensure that the systems are in place to achieve the sustainability of the World Bank's investments in Debre Birhan. We have an opportunity to avoid the pitfalls that have plagued development projects in the past. Next, please. We believe that the components of our two projects provide areas of overlap and offer the following in terms of areas to collaborate. The first area of collaboration is to leverage the existing platform to ensure that all stakeholders' voices are heard. The Debre Birhan Learning Alliance is in its nascent stages. Its members include actors involved in sanitation, some of whom are decision makers in the town's World Bank's activities. As the Learning Alliance establishes itself and moves towards ensuring better representation of typically disenfranchised groups such as women and youth, their participation in informing the design of interventions will promote equitable access to sanitation. It'll also ensure that these interventions are fit for purpose. The second area of collaboration is using the existing studies and information. SWS carried out a baseline consisting of 300 household surveys, key informant interviews with actors across the board, and focus group discussions with communities. The baseline presents the household sanitation situation, residents' perceptions of their neighborhoods and their priorities, as well as social cohesion in the neighborhoods. It presents the service agreements or service arrangements. For example, how are households emptying their toilets and who are providing these services? It also presents who has the mandate for sanitation in the town, what are the guiding policies and strategies, and do these take into account every step along the sanitation service chain? The World Bank is preparing to carry out a feasibility study for sanitation infrastructure and investigations of cost recovery models for the utilities. We are sharing information under our respective projects. We believe that data and knowledge sharing not only provides a comprehensive picture to the town for all involved, but it also helps inform the activities of the two projects. Thirdly, we are undertaking complementary efforts to strengthen the system of actors involved in sanitation by responding to requests from the Learning Alliance for training, for facilitating town-to-town learning or exposure visits, and workshops on federal level policies and strategies for urban sanitation. Finally, we will jointly plan, follow up, and monitor our activities in Debre Birhan under the two projects. Next slide, please. One of the things that we've done is to draw our system boundary around the town, and therefore specifically targeting local urban sanitation actors at town level. All resources and regulations in the sector, such as policies and finance, flow from national level to subnational levels. So we are faced with the task of ensuring that as we work with the Learning Alliance, the local system is connected to the national level system. More specifically, this refers to linking up efforts to roll out the integrated urban sanitation and hygiene strategy, which was approved and endorsed at national level in 2016. This relatively new strategy takes into account the sanitation service chain in its entirety, from containment to disposal or end use, and it has obvious implications for the town, but it's not commonly known at subnational levels, and certainly not to the actors we interact with. We recognize that the interactions between two levels, local actors are waiting for direction from the national level, and we are cognizant of the fact that there is no official coordinated direction from federal government on urban sanitation. From the onset, it has been relatively easy to identify potential Learning Alliance members from key government actors in the space. However, ensuring that membership of the Learning Alliance does not include the usual suspects, but also actually reflects the town level context has required more thought and investigation. And in an effort to do this, we are identifying the interfaces at which actors interact. And we are also integrating often overlooked actors into the system. For example, the users and private operators, as well as less typical actors such as journalists. We often forget the role that journalists have in keeping local government accountable. We recognize that there has been tensions between the institutions with mandates for urban sanitation, which may have arisen when they previously addressed sanitation in a siloed manner. And we also recognize that it'll be challenging to directly engage some critical stakeholders, for example, the producers of industrial waste and large volumes of fecal sludge, who are in some cases the big polluters, but are also the largest employers. We have learned how this has hampered efforts by local authorities to enforce regulations as a direct result of pressure from the communities. You know, we've got the example of a hotel in Debre Birhan that was illegally dumping its waste into storm drains. And after multiple citations from the local government, they shut them down, but there were protests from the communities for which the hotel provided employment. Our sector has focused on service arrangement and infrastructure to achieve sustainable services. But if we fundamentally recognize that the system is complex, then we realize that the missing piece in this equation is collective action. This is the part of the process that targets representation of all into the room and gets them to the point where they can share their experiences and have a voice at that table, and ultimately achieve our goal, that is the goal of the World Bank and SWS, of sustainable citywide sanitation. Next, please. Coordination stands out as the main gap in addressing service delivery in the sector, and hence the case is made for establishing the Learning Alliance. Although there is some coordination happening in the town, it is primarily horizontal among some town-level government actors for specific tasks. For example, the water safety plans that are mandated at federal level. As I mentioned in the previous slide, our objective is a Learning Alliance with representation that reflects the urban sanitation context of Debre Birhan And key to this is identifying the interfaces where users, service providers, and service authorities interact. To this end, we recognize that it'll be necessary to target specific actors for specific issues. For example, in order to address the issues around the management of communal latrines, we will need to ensure that women's associations or the Kabyle or neighborhood development groups have a seat at the table and that their voices are heard versus business as usual, where they're removed from the system and their interactions, for example, with the municipality are not beneficial to them. They only see the municipal official when it's time to collect taxes for the market. This obviously has implications for how our activities are organized in the Learning Alliances, and it has necessitated the formation of subgroups to work on select priority areas in the Learning Alliance. Next, please. We are in the early stages of the project, but two opportunities to increase the likelihood of sustainability have emerged around the issue of leadership. We see an opportunity to leverage the presence of strong Kabyle level agents in Debre Birhan for targeted interventions. These agents appear to have had sustained success in moving households away from the practice of emptying their wastes in open drains. And we think this is in part due to, one, the caliber of the health extension workers who carry out sanitation promotion activities, where the minimum requirement is a nursing degree versus grade 10 for their rural counterparts. And two, the engagement of USAID's Strengthening Ethiopia's Urban Health Program with the Health Extension Program through its training and capacity building activities. We are also working with some active young professionals. For example, Miraf Abi, the deputy manager of the town's utility, who was pictured here on the left. And he has been instrumental. He was instrumental during the baseline and has been the driving force behind establishing the Learning Alliance and facilitating its meetings. Next, please. What we're observing on the ground supports the premise on which the project was developed. We see that issues around communal and public toilets and the town's disposal site are not just about the infrastructure, but rather the breakdown of, or the absence of an ecosystem in which these should be operated. In 12 months, the town will have, through the World Bank project, completed the feasibility study and design of selected interventions. The Learning Alliance will have completed an asset inventory of its communal and public latrines. It will have participated in town-to-town learning events on management models for communal and public latrines, as well as fecal sludge management. It will have undertaken action research in priority areas identified by the Learning Alliance. And it will have participated in training events on federal government policies and strategies for urban sanitation, which would have been jointly provided by the World Bank and SWS. Where we would like to see, or what we would like to see coming out of this collaboration, where we address the collective action, the service arrangements, as well as the infrastructure, is some early evidence or tangible sign of the municipal government's commitment to sanitation issues. And this could be an improved town sanitation business plan with increased allocations for sanitation versus water. This could also be a recovery plan for the utility that has moved beyond the stage of just an endorsed document, but is being implemented or getting ready to be implemented. Next, please. On behalf of SWS, I'd like to thank you for your time and for giving us the opportunity to present our work. We look forward to presenting our updates in 12 months. Thank you.
Excellent. Thank you so much, Lucia and Gulalat, for the presentations. We have about 10 minutes here for some Q&A, and there's a couple questions coming in, but please keep them coming. This first question I want to ask to Gulalat. It's around the Ethiopian tax base for financing sanitation. The question is really around that transition. Do we feel confident that there'll be sufficient tax base to take over some of these services once the donors step away?
Thank you. This is, fortunately, the discussion that I was discussing today with about, 5 utilities. Since we have a very limited, experience of, investing in sanitation, so far all the sanitation is mainly dependent into the support or the subsidy, from either, the city or the municipality or from the water utilities. So this has to be practiced, and this second urban water supply sanitation project, I could say, it is the first in kind, with this massive intervention. So I hope if the service is, there, the people are, willing, and this has been, I'm so sure, with that. We did, some assessment in about 10 towns, and the result from household survey, and also the result, from focus group discussion, it shows that, there is a willingness to pay, but how that is affordable depends, on the technology you are going to choose. And that is why I would say, citywide inclusive sanitation might give us an opportunity to choose, with the technologies and, our comprehensive intervention. Thank you.
Excellent, thank you, Gulat. And the next question here, there's kind of a variety of questions related to the hotel industry. I wanted to try to combine it, Lucia, and ask you just about your experience to date with engaging with the private sectors, particularly the hospitality industry that really requires a functioning sanitation service to continue its own business. How have those discussions gone, and how have they been integrated into the Learning Alliance discussions?
I think with regards to the industry, and maybe I should focus on the brewery and Debre Birhan, the breweries in Debre Birhan versus the hotel. I don't think the Learning Alliance has been able to, at this stage, successfully bring them into the process. But they have with the breweries, and in part because one of the individuals was an ex-municipal official, and I think for him, the drive to be part of this process is that, this is his town. And what we have seen from the Learning Alliance's engagement with them is that, there was an issue with the disposal site in Debre Birhan, where essentially the first disposal site was shut down, and they had to build a second disposal site. And they were able to get the brewery to put some money into not specifically the infrastructure for the disposal site, but rather the access road. And they continue to be part of the conversation with them. And we have to acknowledge that, we're in the early stages of the Learning Alliance with Debre Birhan. But so far they have been quite active in members, or at least have been participating in the meetings. They do attend the meetings. And I think, what we're seeing is that, yes, these actors have the hat that they wear of their official role, whether it's, a municipal government official or whether it's a leader in private sector, but they also wear the hat of a resident of that town. So some of the drive to work in these learning alliances is coming from that desire to improve their town.
Great, thank you. Thank you so much. And then I have another question here. Maybe we'll start with to Gulat for this. It's around this decentralized approach. Has there been a good acceptance at the community level at looking towards decentralized systems and services, and as the World Bank, and I guess also to Lucia, as we are looking at sanitation systems, are we following kind of the mainstream decentralization approach that's happening in Ethiopia at the moment?
Yes, we have the case of Addis Ababa, where really sanitation is a bit better or developed, compared to that of the other towns. In Addis Ababa, we have in a separate treatment, a separate, facilities at different sites, and are operating. I mean, there is no as such, resistance, from community. In fact, what the community need is, or require is about, properly managing, the system. Otherwise, even, the big, system, the World Bank supported is in the middle of, the town. I mean, it's not such a big problem. It is about the management. So I don't expect it becomes, a problem as far as we manage it, properly, and we take care of, the operation and the maintenance.
Great. And maybe this next question, we can start with Lucia, but I want to hear from both of you on this. There's a question about how we're engaging the private sector that provides these services. What role are they playing, maybe to Lucia, as part of the Learning Alliance or as part of the discussions around the regulations and the dumping site? How are they engaged in that conversation? And then maybe to Gulalat, how have they been involved in the infrastructure planning in terms of the services and the options that you were mentioning? So maybe first to Lucia.
Thanks, Dan. One of the things that we recognized quite early on is that there are private operators in the town. But we also recognized that, or identified as we were doing our data collection, that they're not connected to the town level officials. Their connection really is at the neighborhood level, the users that they're providing a service to. And so while they have been brought in to the Learning Alliance, the initial aim for them is to ensure that they're being linked into that town level hierarchy of the government officials. Their concerns, their voices are heard. I have to admit that when it has come to Debre Birhan, what we're seeing is the strength of the Kabeli level or neighborhood level government in terms of not just implementing and enforcing, the government's plan and regulations for household sanitation, but also how linked in, how they provide that bridge between communities and users and the private operators and the upper level levels of government in the town.
Maybe to build up, on this one, with respect to the private sector, I mean, might be recognize that, I mean, since the sector is not well developed, even the engagement of the private sector is not well developed, and it is not that attractive, I mean, so far. Just recently, I mean, besides the support from the consultant in planning, and so maybe in construction by the contractors, the engagement of the private operators, especially for vacuum truck, is increasing, and they have practiced. I mean, in the last 10 years, I think the number of private sector service providers has been increased. With respect to the treatment and the like, I think now the World Bank is going to support under the second water supply and sanitation for Addis Ababa, just as in a pilot, by engaging build and operate contractors like that one. Otherwise, it's not well developed. I mean, have to recognize that one. And
Excellent, thanks so much. So we are right at the hour, and I wanted to make sure that we wrapped up on time. But I first just want to have a big thank you to Mr. Gulalat Ishatu for his presentation on the World Bank's work, as well as to Lucia Henry for the presentation on SWS's activities, and Debre Birhan. We've put in the chat a link to our website. We'll be hosting all these materials there, as well as a rebroadcast of this. And my email address is in there as well. Any questions, if you want to learn more, you can always reach out and I can direct you to various folks, including to Gulalat. And lastly, thank you for all the questions. We weren't able to get to all of them, but we will do our best to respond in writing to any additional questions. So with that, I want to say thank you so much for joining, and we look forward to the next webinar and all of your questions and engagement for that one. So thank you so much.
Have a nice time from our side too. Bye.